Ernestine Sambas, and I will be showing to you how to provide CPR to an infant. So the first thing you need to do is to check for responsiveness by tapping the foot of the baby and tell someone to call for an ambulance or call 911. And if you're alone, you need to do 5 cycles of CPR and call 911. So to begin with, you need to unclot the baby so that you can be able to see the chest movement indicating that the baby is breathing. And if not, you need to do CPR. And if the baby is gasping like this, you still need to do CPR. Then next, place your one hand with one finger breath below the mid-nipple line and over half of the sternum. Then place your other hand on the forehead of the baby, and you are now in a position to do CPR. Then compress at least 1/3 of depth of the chest, or at approximately 1.5 inches. Then place your hand on the chin of the baby and breathe through the baby's mouth, covering the nose. And make sure that the baby's chest is rising up while you are breathing through the baby's mouth. So remember that in one cycle, this consists of 30 compressions and 2 breaths. And now, I will be showing to you the continuous procedure of providing CPR to an infant. Baby, are you okay? Are you alright? Hey, you with the white shirt, call 911, the baby's not breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 9, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 9, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 9, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 9, 30. And that's how you provide CPR to an infant. That's all. Thank you.
Now, we're going to cover the healthcare provider level basic life support for the child. If you don't know the exact age, or it is hard to distinguish whether the child is big enough to get the adult CPR or child CPR, that's the guidelines. If they're showing signs of puberty or big enough, you can do the right adult CPR. But this child is 11 years old, and let's just imagine that this is a real child, and she's now going to the category of receiving CPR child protocol. And we're still checking the scene safety. Our gloves are on since the CPR shield is not available. Let me do the mouth-to-mouth procedure. Then we call out the child. Child, are you okay? There's no response. She's not breathing, moving, or making some noise. You go call the 911 and return and activate the emergency medical services. I might need your help. And I am going to tap the collarbone. Are you okay? Are you alright? There's still no response. Check for the pulse for no more than 10 minutes. I can feel the carotid pulse. There's still no breathing and movement. And do the 30 chest compression and compress about 1/3 the depth of the sternum using one hand between the breast and the center of the sternum. Tilt the head back, cover the nose, and do the mouth-to-mouth procedure and give 2 breaths. After 2 breaths in, continue the 30 chest compression again and give to rescue breath until the AED arrives or an emergency medical services arrives and take over. Child, are you okay? Call the 911 and return. I cannot feel the pulse. I'm gonna do the chest compression.
So good day, Sir Jano. This is Noelle Venenoso and I'll be performing basic life support cardiopulmonary resuscitation in an adult. So this process or procedure, this involves an emergency procedure that gives good chest compressions and artificial ventilation towards the victim. So the first thing that I must do is to secure the whole area. This allows us to provide a good area to do the process and to avoid any hazards to happen. Next is to check for the consciousness of the patient. Call on the patient and check for consciousness. If there is no consciousness or the patient or the victim is unconscious, immediately call for 911 or emergency or ask somebody to call for emergency team. Next is to check for the vital signs of the patient. Kneel beside the patient and check for the breathing and the pulse. If there is no breathing but there is pulse, immediately give emergency ventilations. And if there is pulse and there is breathing, wait for the emergency team to arrive. But in this case, I'll be performing no pulse and no breathing or only gasping. So to check on that, kneel beside the patient, do the head tilt and chin lift, and do the process of listen, look, and feel. That should not be exceeding for 10 seconds, and check for any breathing signs. So 2 normal breathings within 10 seconds would be considered as normal. But in this case, like I've said before, we'll do the latter. Next is to do the whole procedure. So place the patient on a supine position in a firm area. And then with your one hand, place the other hand at the top of the other hand with the fingers intertwined. With the heel of the hand, place it at the center of the chest of the victim at the lower half of the breastbone. And start chest compression. So it should be good compression, good recoil. It should be fast and deep. So the compression should be about 100 to 120 compressions per minute, allowing good recoil so that blood flow would, there should also be good blood flow and diffusion of the bloodstream. And the depth should be about 5 to 6 centimeters. And also give 2 ventilation. So it's a ratio of 30 compressions to 2 ventilations. And repeat this cycle for about 5 times or within 2 minutes or until the patient can recover at a stable stage. And also, if there is AED to arrive or automated external defibrillator, also follow the guidelines on whether to use it or not. But in this case, we will skip that procedure because we have no such equipment. And after that, after performing CPR, check again for vital signs, check again for the consciousness. If he or she, the victim, has been able to stabilize, position the victim in a recovery position. Okay. So I'll be doing the procedure now. Excuse me, ma'am. Ma'am, can you hear me? Excuse me? Hello, 911. There's a patient here stuck at 5th Avenue at the corner of Rojas Street. Thank you. Excuse me, ma'am. Hear me? Ma'am, can you hear me? Can you hear me? Assuming that the patient has recovered and we've done the 5 cycles for 2 minutes, place the patient on a recovery position.
I'm going to demonstrate the Heimlich maneuver on an adult and on an infant. But first, you will see the steps on how to perform the Heimlich maneuver on an infant. The infant must be placed on your forearm, supporting the head with your hand, and you have to find a place for you to sit, with the infant placing the head downward and where you will be able to support their weight securely. And then you will deliver a series of 5 back blows using the flat portion of your hand to the center of the back between the shoulder blades. So 1, 2, 3, 4, 5. And after this, if the back blows do not clear the infant's airway, you have to turn the infants over, supporting the head, and institute a series of 5 chest thrusts using 2 fingers to the center of the chest. So 1, 2, 3, 4, 5. And then you have to repeat it again. You will continue the 5 back blows and 5 chest thrusts until the trapped objects becomes dislodged. And of course, don't forget, or you have to make sure to call the 911 for emergency response for your child. Now I'm going to demonstrate the Heimlich maneuver on an adult. So for example, I have here my brother. The scenario is he is sitting and then eventually start choking. The indication is mostly this, which is the universal sign of choking, a hand clutch to the throat. So, and also there is an inability to talk or speak, and then cannot cough, and also difficulty to breathe. So if that will happen, I have to call for help or have them help me up. And then activate the emergency response or call for 911. And then I have to ask the patient, are you okay? And also ask permission and explain to him that I know how to help and can I help him if possible. So I have to start. I'm going to stand behind his back, and then I will find his belly button, because since this is my landmark to make a fist on one hand above the navel and where the thumb side midline on the abdomen and well below the tip of the xiphoid process. Then I have to grasp the fist with the other hand and deliver a quick upward and inward thrust. So in and up, in and up, in and up. And then I have to repeat the process until the obstruction is removed. So, or the victim loses consciousness. However, if the adult victim with foreign body airway obstruction becomes unresponsive, move him to the ground and begin the CPR. So again, I have to find his navel and then chest and then grasp, in and out, in and out, in and out, in and out. So that's it.